In the face of global challenges, such as the ongoing health crisis, climate change, wars, and social upheaval, addressing the impact of these crises on social and mental well-being is paramount. The repercussions of these crises extend beyond the visible realm. As we navigate the challenges of these uncertain times, it is imperative to acknowledge and prioritize our mental well-being. There is a growing need to expand our discourse, exploring the profound impact on well-being beyond the biomedical sphere. In our 11th edition of the WOMENTUM Digital Saloon on mental health in the time of crises, we will delve into the vital role of arts in navigating mental health during crises, recognizing its transformative power. We will shine a spotlight on vulnerable populations, dissecting how this topic uniquely affects them, emphasizing intersectionality. Our dialogue will also unravel how various factors intertwine, influencing mental well-being. Excitingly, we have 4 high-level speakers with diverse backgrounds and outstanding work in the field, bringing unique perspectives to enrich our dialogue. Join us in a refreshing conversation that advocates for a holistic approach to mental health in crises, fostering resilience and understanding in diverse contexts.
Hello, everyone. This is Nisreen Deeb. I'm the director of the Lebanese League for Women in Business from Lebanon, an organization that works with thousands of women in the country to empower them economically and to support them to be economically active and growing. I'm very honored to be moderating the 11th Digital Saloon by Lead Initiative, speaking about a very important topic and essential nowadays and each and every time. I'm very happy and very honored to have diverse speakers and experts from the MENA region, from Africa, and from Europe. We have with us Bochra Triki. She's from Tunisia, and she's a multidisciplinary cultural manager and feminist activist. We have from Belgium, Juliette Roussel. She's a mental health advocate and a humanitarian professional with an intensive experience in advocacy and research in the EU. We have from Kenya, Terry Otieno. She's an SDG consultant, non-state actor, climate change and gender rights policy analyst. Last but not least, we have Noof Assi from Iraq. She's a dedicated gender-based violence and emergency specialist. Dear speakers, I'm very honored again to have you with me. We will kick off this interesting discussion that's going to be a very formal, informal discussion. I'll be having a set of questions, but please do feel free to step out of your comfort zone and the frame that we have already agreed on multiple times. I will be starting with a round of introduction. So please, Bochra, then Juliette, then Terry, then Noof, if you please introduce each other, what you exactly do, and if you give us an insight and take us to your countries, speaking about mental health, what is mental health and how it's perceived in your country throughout the history, and in addition to what you do in your country. Please go ahead.
Okay. Hi, Nisreen, and hi, everyone, and thank you for the invitation. So I'm Bochra Triki, I'm Tunisian, and I'm a curator, artist, and I have a big focus on feminist and queer issues in my practice. Yeah, I also work through a lot of mediums. I do sound installations, podcasts, and short movie. So you were asking about mental illness in my context or in my country. Of course, it's still a little bit, it's still taboo, but it's going better for a lot of reasons. First, I think it's also the awareness about mental health is going better globally, and we have more and more information about what is happening in our own selves. And it's also going better thanks to a lot of collectives and organizations, local collectives and organizations that also raised a lot of awareness, but are also on the ground to be able to give kind of solutions for that. And it's especially feminist, queer, and people of colors organizations that are taking the lead on this topic since they are at the same time the most vulnerable or very vulnerable communities, but they are also the ones that are creating a lot of literature on this topic now.
I agree with you, Bochra. Thank you so much. Moving to Juliette.
Hello, my name is Juliette Roussel. I am from Belgium. So I am a mental health advocate and humanitarian professional working on mental health and psychosocial support at a global level as well as at the EU level. So I have extensive experience in research, advocacy, policy, and project coordination. I could speak, of the global level, I could speak of the EU level, but I will bringing a little bit of light at the Belgian level, which, to be fair, I haven't worked on so much. But I think I do want to highlight that there's still a lot to move forward with when it comes to mental health, even in countries that are perceived as so-called developed and richer. There's still a lot of stigma. There's still a lot of barriers to accessing mental health care. And I think that the pandemic really has highlighted the need to improve quality access to mental health care for both specialized services as well as more non-focused and community support. And I am also very proud of my country because they have been very much moving forward with deinstitutionalization and really giving support to people, not necessarily within strict psychiatric facilities, but rather through enhancing family, community, and friendship, for example, supports.
Thank you so much, Juliette. Moving now to Noof.
Thank you, everyone. My name is Noof Assi, and I'm from Baghdad, Iraq. I work as a gender-based violence and emergencies specialist. So at a global level, like working with in different emergencies with women and girls who are survivors of gender-based violence and providing them with psychosocial support and promoting MHPSS in general. But also at the local level, let's say in my home country is in Iraq, is talking about MHPSS or mental health is similar to many countries. It's still a taboo. It's still something that we are ashamed to admit. We try always to show the strength of we are fine, we're not facing traumas, we're not dealing with lots of pressures and issues, so that we don't need a professional to provide us with the support. However, these are there are lots of changes now, due to the activists, civil societies who are providing awareness to the community about the importance of handling these issues and how to make sure that we don't reach the level where it become harmful more, and having not only MH does not mean mental health does not mean we need only psychiatrists or professional doctors. We can do it at different levels. We can do it at the community level. We can work as a building resilience within our, let's say, community family protection cycles for each and every person, so that we handle the issues that we are facing at the moment. So we see that there is lots of changes and developments in that within especially the new generations with the youth and how they are perceiving these ideas. However, it's still work in progress, let's say. Thank you.
We share the same thing in Lebanon, by the way. Recently, with the big challenges, we started recognizing what is mental health. Thank you so much. Terry, welcome from Kenya.
Oh, I was also going to start by saying that we share some of the challenges that Noof has already mentioned. Coming from Africa and now in Kenya, my country, we are called to be more resilient. And so mental health to us is not really a thing. But then we are building onto it, especially because of the aftermath of the COVID-19 pandemic. And so my name is Otieno, yeah, and I am a policy expert in DRR and also a social activist. I campaign for a range of issues, including climate change, the food system, gender and education rights for children and youth. Currently, I serve as a global focal point for the DRR working group in MGCY and also as a co-chair in UNDRR SEM. What I would say about mental health in Kenya is to a great extent, we see it as a result of lack of communication or inclusion of children and youth. Because for us, we know a crisis can come from any point. At times, it's really sudden, and so it's no one's fault. But then when we are excluded from the decision-making table and given information as aftermath, it heightens our anxiety and feelings of confusion and hopelessness, and it pushes us to compulsive disorders, obsessing over matters so much. And yeah, so that to me is what mental health is in Kenya.
Thank you so much, Terry. Thank you, Bochra, Noof, and Juliette. So now I'll be moving a bit to start the conversation with a bit in artistic manner. It's something that before we go more intense into the discussion, I'll be moving to Bochra, since you have a very extensive experience and your work spans multidisciplinary cultural management, and you have a big experience. How do you see the intersection of arts and social justice can contribute to the mental health awareness, especially in a crisis-affected communities?
Okay, this is a very, very wide subject, but I will try to to resume a little bit. First, I wanted to say that in my perspective and in the perspective of a lot of persons that I work with, art is political. And art is political in a way that artists will be affected by their context and will be affected by their individual lives, but historical traumas that can happen, and art can't really be dissociated from the context, even when we want to. It's also a political act to not be dissociated. So, when we started after 2011, a lot of collectives started to be able to do something, because before it wasn't. It wasn't the case. We couldn't do anything political or bold in Tunisia. So when we had the chance to do it, a lot of art as a way of expression. So yeah, about the intersectionality between art and mental health. For me, mental health. Okay, so about the intersection between art and mental health, from my perspective and from the perspective of a lot of persons I work with or collaborate, art is a political statement, and it's because it's always related in a way or another to a context, and it's also related either to a political context or an individual one. And it's one of this very efficient way to be able to talk about very difficult situations and to transform it into another medium, and to be able to give very triggering subjects to an audience, and create a distance also, so audience can be able to take it and be able also to analyze, think about it, feel it, more than just be hit with violent stories. Even if art can be also very violent, but still it's a piece, it's something that has been created, not necessarily reality. So we, as collectives, queer and feminist collectives, we thought that it was a good medium for us to be able to reach a wider audience an audience that is not necessarily the one that is the closest to us, to these topics, since people will come because they are interested by the artist or by the medium, or just to party or whatever. And in the meantime, they will be seeing performances and artworks that are talking about subjects, very personal and very also political subjects. And it will either way gives the permission to all of us to think about it. And another thing is art is also very, very important for the person that practices art. And we know now that also there is this race of art therapy, which is like very important, and that should be like more and more institutionalized, because like the artistic process is one of the ways of being able to face our own traumas and our own, is really transforming it something else and being able to share. Because in in mental health care, sharing is very important. So it's a good way to do it.
Thank you so much, Bochra. Wow, you took us into very, very deep thought about it, and I'm very happy, and I cannot agree more about two things you have mentioned. First, that the art is a type of therapy, and we have noticed multiple therapists, they use this way, even for the people who cannot express in arts, they explain it in a very easy and smooth way. But the other very important point in your intervention, Bochra, is how it can play a role against, actually, and a harsh role on the person, maybe. So the art should be also transferring really the real message behind. So, and this is something very interesting, because sometimes you might see an art that is maybe kind of harsh, or maybe kind of not transferring the message well. So thank you so much for this. So moving from the arts vibes, if I'm going to say, I'll be moving to some rigid content here, and I'll be moving my question to Juliette. Juliette, how do you think from an experience, and you really work with the EU and the advocacy and the policy, how we can shift the understanding of mental health from medical perspective to psychomental?
Yes, well, thank you, Nisreen, for the question, and thank you so much, Bochra, for your input on art therapy, which has indeed become very important in shifting from a biomedical model to mental health care to a more psychosocial model to mental health care. So I talked about deinstitutionalization earlier in Belgium, but that counts as well at EU level, and in our approach to responding to humanitarian crisis when it comes to supporting mental health needs. So we'll first expand on this. So what does it mean to talk about a psychosocial approach to mental health and psychosocial support? Well, it's to recognize that there's an interplay between the individual and the collective, as well as the psychological and the socio-cultural, so that all those dimensions are relevant to the well-being of a person. And having a psychosocial approach considers the interrelation of all these dimensions in informing programming for mental health and psychosocial support. So what we have witnessed in the last few years is a shift from maybe quite simply pathologizing mental health care and going through psychiatric approaches to supporting people, rather than also ensuring that people have access to family and community support. So here in the work that we do in mental health support in humanitarian crisis, as much as looking at the policies that the EU has been moving forward when it comes to promoting mental health, we're really seeing that recognition that we need a more holistic approach to supporting people and their well-being. And that includes as well considering intersectionality, that people can be in different vulnerable groups at the same time, and that all those things can really compound and put people into vulnerable situations. And I will also build upon the discussion on art therapy, which is very much part of community-based approaches to mental health. So that's about promoting a co-creation with the community that we're attempting to serve, rather than having a top-down approach and bringing in specific medication, regardless of the cultural background of the people you're serving, the context, etc. That is not to forget that some people do also need specific psychiatric care. So the psychosocial approach also includes the fact that we do need to consider people with severe mental health conditions, and that those people also need support. Again, it's all about having a holistic approach to this. And I would say that that's the biggest shift that we've seen at a policy level, as well as into humanitarian programming.
Thank you so much, Juliette. And it's not easy, I assume. It's a long journey. It's changing also the mindset, no?
It's a long journey. It's a long journey, especially because vulnerable populations, it touches upon a wide variety of people. And that also means that you have to tackle the biases that go along the different populations that you want to be serving. I think specifically at an EU level, there's been a move towards a more comprehensive approach to mental health care. And that, of course, informs the policies for EU citizens, but also humanitarian programming that is financed by the EU. So it does have implications at a global level as well. And while there is a mention of a variety of vulnerable groups, there's only a few of them that have been receiving explicit support at a financial level. And I think that's something, for example, that we've really witnessed with the wide support for the Ukraine crisis, whereas previous conflicts and wars, such as in Syria, for example, or Yemen, have received way less attention because they were informed by the racism, xenophobic biases of politicians, citizens, etc. So there's still quite a few challenges ahead.
Adding more interesting topics to be discussed, Juliette. A big database. Thank you so much. Now I'll be moving to Noof, and speaking about the last point and linking it to what's happening currently, the last point of Juliette. Noor, you are a gender-based violence and this is something, unfortunately, that the world is always needing it. So we need you really to explain to us how you do it and what are the other ways of doing it and what you have noticed, Noor.
So mainly, unfortunately, in emergencies, when you talk about a crisis, whether if it's natural disasters, if it's war and conflict disasters, we mainly see that the most affected are or the most vulnerable are women and girls, and who are majorly facing gender-based violence. We see that sometimes in conflict crisis and or emergencies that women and girls, even gender-based violence is used as part of the weapons of war, unfortunately. And also aside from that, we look at how they are trying, it's as a secondary, that working into providing safe spaces, providing psychosocial support for survivors, providing awareness raising, working with building community resilience or community-based approaches to receive services, and what are the available services for you as gender-based violence survivor. These are always challenges. The other added challenge always within emergencies normally is the first humanitarian action to respond to emergencies starts with shelter, food, health services, but that comes as a secondary, that working into providing safe spaces, providing psychosocial support for survivors, providing awareness raising, working with building community resilience or community-based approaches to provide, like, let's say, safety nets for women and girls and vulnerable groups. These are like always like something that it's not, I don't want to say forgotten, but it's always like, not comes as a priority, like providing food and shelter and health in emergencies. But it is also important because when you look at like gender-based violence, it comes from how the community is dealing with survivors, dealing with women and girls, for example, and also how it's affecting as well the access to services that are like, as a human being, you have different rights, but it's different from community to community, that how many rights you get as woman or girl, or like based on your gender as well. So all these things affects, like, I'm going to give you an example, a small examples, like we see in the like part of, like, we always like say is like part of like the human rights for each and every human being, that they have the right, like, of movement, for example. It's not the same everywhere for women and girls. In some locations that they are not able, like, to leave their homes, like, to receive the basic services. They are not able, like, to go to receive health services, education. Most of the times, like, we see, due to economic situations and so on, that girls are like facing early marriages, and it's also gender-based violence. Normally, also when we talk about gender-based violence, we focus about sexual violence, sexual harassment, but it's not the case all the time. We have like the emotional violence, we have physical violence, and we have economical violence. These are like the areas where, like, sometimes it's not really focused on, where we focus more into sexual violence, because communities see it as a taboo, because communities see only sexual violence, that is something that is affecting the whole community, the small community, and how it's stigmatized, like the community stigmatized the families, like, of the survivors as well. But we are seeing other sides, and how, like, and when you see is like emergency responses, and you see is like survivors, sometimes you say that, like, it's not really effective, like, to do is like teeny tiny touches, let's say, of creating a safe space, creating recreational activities for women and girls, or like talking, or like doing like community groups, like just like for discussions and talking and socializing, building that community resilience is really like have that effect. And we can see that even in emergencies, doing these activities, community-based approaches for psychosocial support, how can it affect, how can change life, how can save lives as well. I can go on and on and on, it's like Nisreen guiding me a bit into the discussion.
Thank you so much, Noof, for this valuable intervention as well. Now I'll be moving to Terry. We talked about arts in the community. We talked about the policies, and we talked about how we can change maybe the mindset. We talked with Noof about the gender-based violence and how sometimes it's received in a wrong way and in the terms of crisis. And when we speak about the terms of crisis and the wars, as Noof said, the most affected are the girls and the children. With your extensive experience, Terry, with the children, I want really to have your insights. What is mental health for the children? And what are the strategies that you usually do and that are effective in terms of supporting mental health with the children, even though that I do agree it might not be common?
Yeah, so advocating for mental health for the young people takes different spheres. It can be economic or social, but we try and do much more, especially because we are good with the communication, but we do not have, say, the experience or the finances that would be put in other bigger interventions. So staying in the loop as children and youth to learn about and understand new developments in terms of crisis helps a lot. And being armed with the information can conquer the fear that we have as the young people, and how we cope with the others, like how we help other people. So in the midst of crisis, most of us are filled with anxiety, and it can even turn to anger due to not understanding the situation. So support from humanitarians can aid in quick bounce back to allow us to keep us with the information we need in order to reach out to others. So we can have social connections, especially face-to-face ones. Currently, people are used to a lot of digital interventions where you easily find that we have trainings, we have even psychosocial support that are online. But for the young people, it is easier for us to talk one-on-one and encourage each other. We also have to stay active and encourage those who are around us to be active. So we also need to appeal to our senses. The information we get, if it is rational and logical, then it helps us calm our fears, and we also disseminate the same information to others and calm them as well. We also need to exercise and eat properly, just so that our brains are healthy, and if we sleep enough, we are also in a way like keeping up with our health as whole. It allows us to be more fully present in the moment and recognize that this is a crisis, and someone else's emergency is not mine. But at the same time, if I am whole enough, I can reach out to other people. And another way that youth can help in advocating for mental health in times of crisis is creating memes and short videos, because you're good with technology. So when we sort of interact with people using our strength, it helps. You can also disseminate the toll-free numbers, or those that are serviced, or have people who use multilingual approaches to access the people during crisis, such that the more we interact with people and we are out there, the more information we share. And that is our sort of advocacy, because we have strength in being energetic, and we have the mobility as part of it, that we can move around. And if we have information, that is the key point, where if the young people are given information and are allowed to be in the decision-making tables, then we will be able to do our best in terms of advocating for mental health for ourselves and for those around us.
Thank you so much, Terry. So now I'll be moving back to Bochra. And as you mentioned in your first intervention, that you have organized a lot of festivals, and as a co-founder of the Shoof organizations, I want really to seek your advice maybe and your insights about cultural initiatives and the platforms for marginalized voices that can really make a change. For example, I'm going to give you an example. At LLWB, what we do a lot of events. We do a lot of roundtable discussion, but we never inserted the art in order to express a message or a theme that we are going to do. If it's not pure a cultural event or not pure an artistic event, do you think that this can still be integrated in all our events that we do?
Okay, it's funny, because actually in Shoof, it started exactly the opposite. It's really started as an artistic collective and platform that were all persons that identify as women that has non-normative gender expression and or sexual orientation. So to be more specific, more like it was collective of lesbian, bi, and trans persons. Focus on that, but also we had like a lot of people with us. So it really started I joined in 2015. The first idea was to create a collective that is focused on creating artworks and especially like movie videos on our stories and on our issues. So it started like this, but after it grew by necessity because we understood that we can't only focus in art about trying to be present also for the community while listening to stories of the community and sharing our own stories. We couldn't be here without saying, okay, we have to do something. So this collective and collectives very very fast transformed into also places, communitarian places and places of raising awareness, to exchange, to discuss, also to do advocacy. We did a lot of advocacy, especially, for example, during the 2017, where Tunisia received and 20 recognition on the abolition of the Article 230 that criminalized homosexuality, but also to stop doing the anal test because it is still used as it is still used as a proof for homosexuality, which is an act of torture. So during this round of UPR, Tunisia received like more than 20 recommendations, which is a lot. Like the UPR before, it was only 2 recommendations. And it is thanks to collectives that did a huge advocacy on that. And for the first time, the human rights minister said publicly in front of all the UN that they will stop doing the anal test. And for the record, before after that, there is still like few cases, but it totally increased. Like the number totally increased. So we didn't only stay in the artistic bubble, but the artistic bubble was a way to gather the community, to gather the audience, to be able like to have like this kind of we say a facade in French. I don't know how to say it in English, but to have like something that we can be public with. And we had also like a lot of work with the community. So it totally intersect together, because we will take and the community will take from us to create art and spaces, and kind of give back, but also give the visibility and give what we need as messages. So
Thank you
yeah,
so
to
much.
answer your question, I think it can be relevant to do both.
Thank you so much, Bochra. Thank you. I'll be moving now to Noof, and to build on Bochra's point, because we know that also the youth contribute a lot in the arts and contribute a lot in those festivals and in those activities. How do you think, as a co-founder of the IQ Peace for Youth, how do you see the intersection of youth activism, gender-based violence awareness, and mental health support in the emergency situation happening?
Mainly, the IQ Peace was created like on general, based on like peace building, working as youth to contribute to the community. Also, it's like to stop like the image of violence and war that we were like facing in Iraq, mainly in Baghdad. Like the image that was given, that it's only conflict, it's not safe, people are not living their lives, people are only like hiding from violence and killing. So that was like the idea for us, like to initiate IQ Peace with a small idea in 2011, where we were like trying like to link that we are living in a city called the City of Peace, or Baghdad Dar es Salaam in Arabic, and how we are like trying to link it with the International Day of Peace, as well as like showing that to the community that we can, as youth, do something, contribute to the community, to contribute to the city that we are living in. So that was like the idea that we created a festival, 100% voluntarily, like led by youth, to just like to give the idea and link between Baghdad and peace. Then the idea grew into seeing how to be honest, like we didn't plan and to like link it with like, let's say, psychosocial support at the beginning, or like providing awareness raising, but we saw the effects back then on the volunteers themselves, on the community, and how they were receiving the idea of youth contributing in different ways. So we opened it up more. It's become like more, let's say, artistic. We saw like lots of initiatives, like we linked up like youth initiatives like together. We linked up artists, musicians, and then we started linking up the not only like artists, like anyone with any interest, any even cooking, even food, even handicrafts. We created that, like, let's say, a young community of supporting each other and supporting the community. After 10 years of working on that, growing that idea, I can see now that we have a lot of resilience among like not only the volunteers themselves within IQPs, but also within the community. We saw how that idea, let's say, inspired others to do something similar. So in 2011, I can say we were like a really teeny tiny, small youth-led initiative that was like one of the first like to do something outdoor, a bit like, let's say, artistically in Baghdad. And then it's like we grow into having different activities now. The community are receiving these activities, the community, and I see lots of like families like come to us asking us if we can include their, let's say, adolescent girls and boys like within like the volunteer groups, because they're seeing how it's effective, how it's changing the perspective, how it's making everyone looking at each other as human beings, aside from like what are like the differences, especially at sometimes like especially 2006, 2007, we had like a civil war, sectarian war, like in Iraq. So that was like, let's say, is like the taboo is that, and everybody focused about like the differences, the backgrounds, and so on, and how like that change within like the community, the small community that we created among youth changed. Now we grow into, let's say, being like more experience and more initiatives within the umbrella of IQPs to talk about different matters. So now, like, for example, like we do have different clubs. One of like we're in a club that we talk about are faced by within the community. How can we support each other? How can we tackle issues that we are facing? How can we do advocacy? Even within our own communities, not like, let's say, at like higher level, like kind of policy changing and so on, advocacy, but within our communities, how we are like advocating to have more rights, to have girls have more access to education, to community initiatives, to have their own lives, to have more freedom. And freedom is like definitely it is defined in different countries within, let's say, backgrounds, cultures, and so on. And we are trying like to work within these, let's say, lines and respect all the cultures and backgrounds, but also like to show these new generations how can we accept each other, how peace comes within ourselves. If we accept ourselves there, how can we build a stronger community? How can we support each other? So that gives safe space for youth to express their issues. We saw lots of even survivors, gender-based violence survivors, coming forward and saying that I trust this community or this bubble of or groups of youth, like to talk about like the issues I'm facing, and I'm here to seek help. This is something that normally is like within the cultures and in different cultures, like looking around the world, that women and girls or like GBV survivors, they don't talk about like their issues. They don't talk about what they are facing just because it's taboo. It is something internal. We don't express about what we are facing with strangers. But creating that safe space, that resilience, that brought like the courage like to these women and girls to come forward to us strangers and consider us a family, friend, trusted persons like to talk to try like to find alternatives and ways to solve like what they are facing, to talk to others and like encourage them to seek help whenever like they are facing violence, they are facing challenges within their lives.
Thank you so much, Noof. So basically having a platform and a safe space for people to come and really to talk. Also here in Lebanon, when no one is talking about mental health, it's going to be forgotten. But when you bring people to the table and when you start talking about it, the word of the mouth is something very interesting. Even if we are in our closed circle, our friends, if we speak about mental health, people will be started to be aware. I'll be moving to Terry to have, I'm going to ask you, Terry, here, since we tackled the children, we tackled also the youth, we tackled what are the challenges, what we are doing, what do you need? Terry, coming from Kenya and from other countries and from your work at the ground, what do you think it's more needed really to give the awareness, the advocacy that brings support to the children about the mental health?
So much support is needed in terms of mentorship to begin with, because we give what we have been given. We have to first be taught, and then we can now disseminate the contents. So we need mentorship and training, and at the same time we need platforms and access to other platforms, because if we are made to be like social media managers, then we have the time to create the content to send out. So we need the platforms to be offered to us, credible ones. I mean, if you run an organization, then you can give access to a youth who will have the time to run the social medias, because most of the times organization heads do not have time to manage the social medias. But because of lack of trust, they end up hoarding the logins. And so the social medias are not active. And so if someone posts from, say, a recognized organization, let me give an example of an international one, like one of the UN entities, then most people will pay attention to that post because it has come from that organization. But if, as a youth, I just use my own social media handles, then it's not even going to have traction. So we need trust as is, because you have to trust us through as much as you mentor us in order for us to be effective in advocating for mental health issues. Apart from that, we also need to be empowered economically. Most of the times, the young people are expected to advocate for free. You're disseminating information. So what's there to get paid for? And so at times we divert our attention to economic activities that will give us money, because we also need to survive and pay our bills and go to school. So if we could also bring in that financial aspect where we are empowered economically, we get returns for our efforts. We could, like do a 50-50 where we are giving our as volunteers, but at the same time, we get returns for it. That means we might dedicate much more time to the causes of supporting mental health compared to when we are fully not compensated financially. So yeah, that is those are just some of the few points that I know that if they're brought to light and really supported, we will be able to help in advocating for mental health.
Thank you so much, Terry. So I'm taking all of those requests to you, Juliette. I'm just here transferring what is needed to be done and what is the importance of the arts perspective, of the youth platform, of the discussions, of the community-based solutions, and definitely a lot of things that Terry has mentioned, the funding, for example, and the other ways of support to you. As a person who has really a big experience in policies and advocacy and how the EU is looking at this perspective and what are maybe the changes that in the EU policies that have impacted the support and what is still lacking and what is still missing.
Thank you, Nisreen, for the question. And I will definitely be building up on the interventions from the other speakers because we need an interplay between bottom-up approaches that come from the community for the community, but also political commitment and funding at a global level. At the moment, we have very different political commitments to ensuring access to mental health care and psychosocial support in the world, in different countries. And at the same time, we have wonderful people like the people here who are not only advocating, but really building initiatives and opportunities for vulnerable groups and populations to really be standing up and speaking for themselves. However, the issue with most of those initiatives is that they're very small and they lack funding and support. So I think that we really have to figure out ways to bridge the gap between those two levels and have a strong political commitment associated with funding to support the community-based approaches and initiatives in a variety of countries. On top of this, as much as there's a recognition that approaches such as art therapy, yoga therapy, sports play, drama therapy even, have very, very strong impact in supporting people in their psychosocial well-being, we also have to remember that as much as it's important to support individual resilience, we shouldn't forget that we also need structural solutions to human suffering. That human suffering, for many reasons, comes from poverty, it comes from racism, it comes from rare diseases associated with specific health conditions. There's a wide variety of issues that can really come into play and have an impact on the mental health of people in general. And so it's that recognition that also ensures that we need to continue ask for political commitment to address those structural inequalities that keep oppressing people, to complement the work that communities really do to support their own mental health. So I think it's really something at both sides that needs to happen. And we need more synergy between the political global scene or national scene and the local regional efforts to supporting mental health in crisis.
Thank you so much, Juliette. So that's the best conclusion maybe we can come with to end our webinar, that it's a collective and it's a joint effort between each and everyone, from individual to organizations, to international community, to the media as well. We didn't tackle maybe in our discussion the importance of the media, that we need to push also the media, whether media on all platforms, whether social media, whether TV, whether in our movies, to inject what is the mental health and its importance. As a person coming from Lebanon, and at least in the last 4 years, we passed through a lot, as I said before, As LLWB, for example, we have created a mental health task force. I'm going to just mention a very sad truth that happened to us, that we created a mental health task force and we were asking our experts, mental health experts, to give free webinars and workshops to our members. Yet we discovered that our mental health experts need more support from international experts. So we brought to the table international experts to support our mental health experts in order to support our community, which is something challenging, but it happened, and this is how we should face it. Before we end this very interesting session, if anyone wants to say like a very one word closing, one sentence, please do feel free. Starting with Bochra as usual. Any closing remark you want us to leave with?
No, I just want to say that really thank you so much, because every insight was very interesting, and for me it was also a way to know more how it's happening, and to discover very, very, very interesting speakers also. So thank you.
Thank you, Bochra, for your great intervention. Thank you. Noof?
I just want to say, similar like to Bochra, thank you so much. It was like interesting discussion with all the speakers, and I want to say always like how mental health is important at different levels. Unfortunately, within the world that we are seeing lots of crises. What is happening recently, even in Palestine, how it's affecting, how there is a need always like to provide support at teeny tiny level, whatever that we can support. It is helpful to everyone. It is helpful to people who are under crisis. So always remember them, always post about them, always talk about people and provide that awareness. Thank you.
Thank you so much, Noof. Juliette?
I will be repetitive and say thank you again for hosting us in this webinar, and thank you for the other speakers for being present. We've talked about collective efforts, and we've talked about co-creation and participatory processes, and I think this is exactly the kind of initiative that falls into how we should be moving forward. So I hope it will not only inspire us, but also the people watching. And just very grateful for being here.
Thank you so much. We are very honored to have you all together. Terry, any closing remark?
Yeah, I will also start by thanking the organizers for bringing us here for the 11th edition on discussing mental health in times of crisis, and to just reinforce and emphasize that systematic thinking, where we consider each other and try to understand the relationship dynamics and perspective, help a lot, because it facilitates open communication and shared values among us. And when we continue building trusts and understanding and empathy among ourselves, then we will be able to approach these mental health issues in a confidence and without reproach, and that is the best way in which we can address mental health crisis. Otherwise, thank you.
Thank you so much, Terry, Noof, Juliette, and Bochra. You were really very inspiring to me. I learned a lot from each and every one to you. Myself, I will leave the audience with 2 cents. Keep talking about mental health. Keep mentioning the word mental health, and remember that it's in these times, it's the only thing that is common with everyone and with all the communities. We can all gather from all backgrounds, from all beliefs, from all even appearances into one topic that is the mental health. We need it. Thank you so much, ladies. You are true leaders in advocating for the mental health and changing people's life. Thank you so much. Thank you for the audience and for lead as well. Please stay tuned with us for our digital Saloon number 12 coming soon. Thank you.